Hello friends, today I will be talking about the different X-rays in ENT. These are the plain X-rays, AP and lateral view, soft tissue neck of 14-year male, and these are the normal X-rays in which we can see this is the esophagus, this is the trachea, this is the hyoid bone, this is the pharynx, and this is the cervical vertebra with its normal lordosis. These are the plain X-rays, AP and lateral view, soft tissue neck of 5-year male child showing circular radio opaque shadow in front of C6, C7 cervical vertebra. Most probably the foreign body is coin and the diagnosis is foreign body esophagus. Treatment is removal of this foreign body by using rigid esophagoscope, and the procedure is known as rigid esophagoscopy. This is a plain X-ray, soft tissue neck, lateral view, showing linear radio opaque shadow in front of C6, C7 cervical vertebra. Most probably the diagnosis is foreign body esophagus, and the foreign body is most probably the bone, and we can also see air shadow in the esophagus. We can count cervical vertebra from above or below. From above we can count as 1, 2, 3, 4, 5, 6 and 7, and this foreign body is present in front of C6 and C7 cervical vertebra. For treating this condition we need rigid esophagoscope, and the procedure is known as rigid esophagoscopy. In this X-ray also we can see a radio opaque shadow in front of C5 and C6 cervical vertebra, and the diagnosis is foreign body esophagus. And in this X-ray also we can see a radio opaque shadow in the esophagus. The diagnosis is foreign body esophagus. We can also see foreign body in this X-ray also, and this is the foreign body esophagus. This is the plain X-ray, nose and nasopharynx, occipitomental view of 43-year-old female, and this is the normal X-ray in which we can see bilateral maxillary sinus. This is the nasal septum, this is the nasal cavity, these are the orbit, and this is the frontal sinus, and this is the area for ethmoidal sinus. This is the plain X-ray, nose and nasopharynx, occipitomental view of 21-year male, in which we can see haziness in right maxillary sinus, and the probable diagnosis is right maxillary sinusitis. All other sinuses like maxillary sinus of left side frontal looks normal. This is the plain X-ray, nose and nasopharynx, occipitomental view showing convex homogeneous opacity in maxillary sinus. The most probable diagnosis is maxillary polyp. These are the plain X-rays of nasopharynx, AP and lateral view, showing soft tissue mass in the nasopharynx originating from the skull base, which is present behind the airway, and so the most probable diagnosis is hypertrophic adenoid, and patient may have features of adenoid faces like crowded teeth, high arch palate, pinched nose, mouth breathing, and patient may need surgical removal of this adenoid known as adenoidectomy. This is the plain X-ray of nasopharynx showing soft tissue mass in front of the airway. So it's probably the mass arising from the nasal cavity, and the probable diagnosis is enterocanal polyp. This is the mass, this is the airway, and this is the skull base. If the air shadow is in this X-ray, if the air shadow is present in front of the mass, then this is the adenoid hypertrophy. But if the air shadow is present between the mass and the skull base, then this is enterocanal polyp. Enterocanal polyp, it arises from the maxillary sinus, then it goes posteriorly into choana and into the nasopharynx. These are the X-rays, AP and lateral view of nasal bone, showing the fracture of nasal bone. This is also an X-ray of nasal bone showing displaced comminuted fracture of nasal bone. This is the plain X-ray, Schuller's view, showing pneumatized mastoid air cell. This is the dural plate. This is the external auditory canal, and we can see the condyle of mandible forming a temporomandibular joint. Thanks for watching. See you in next video.